Well, hello everyone. This is Dr. Amigues, your friendly rheumatologist for another live Rheumatology 101. And today we are talking about when you feel like you have an autoimmune disorder or rheumatologic disorder, but you have a negative ANA or any other antibodies that are all of them are negative. And so you may have heard, no, you don't have a rheumatologic disorder, but you're still feeling in your bone that that's what's happening. We Well, I'm going to do this again because apparently I was muted. I'm Dr. Isabelle Amigues, your friendly rheumatologist, for another 101 Live, Rheumatology 101 Live. Today, we're talking about what happens when you think that you have an autoimmune disorder, but you're negative antibodies, you have negative ANA, you have negative everything, and maybe some doctors have told, or some nurse practitioner or advanced practitioners have told you you do not have a rheumatologic disorder, yet you feel like you have one. What do we do in those cases? Before I go into this, I want to share with you a very exciting project I'm working on currently with my team. It's a website for positive ANA. So it's called positiveana.com. It's free. You have so many resources. There's going to be videos from me, but I'm also going to interview other rheumatologists that are in the different autoimmune and rheumatologic conditions, so that you get one hub where if you are a patient and you've been wondering about ANA, you can learn stuff there. If you are a physician or advanced practitioner, you can also share, you can learn for you, or you can share it with other patients, with your patients that have a positive ANA, or on the other side that have a negative ANA. So it's called positiveana.com. And I highly, highly recommend that you check it out. I think, and let me know if there is anything that you would want to see in there. The goal of this website is really to empower people, empower patients, empower healthcare workers. Okay, so that being said, let's talk about what happens when you think that you have an autoimmune disorder or rheumatologic disorder, yet your ANA is negative, or your antibodies in general is negative. So let's say you feel like you have an autoimmune disorder. So the number one thing is I always want to share this. You are a patient. You know your body better than anyone else. No one knows your body as well as you do. So from there, listen to what it has to say. If your intuition is telling you this is autoimmune, make sure you actually do indeed see a rheumatologist. And there are some rheumatology practices that have so much work that they are trying to really go to only the things that are easy. And the thing that are easy is that if you have an antibody, then it's easier for them to make a diagnosis. So that's what they go to. But there are other rheumatologists like me, like myself, who will see patients who are wondering if they have an autoimmune disorder, because you absolutely can have an autoimmune disorder without a positive ANA or without a positive antibody. Okay. So when we are thinking from a rheumatologist perspective, from me as your rheumatologist, when we are thinking of rheumatology, the first and most important thing is to look at your symptoms. What are your symptoms? And so if you have symptoms that are cyclic, that come, and when they come, it's almost like you know what you're going to develop. So you're developing flares that are similar again and again, and you have episodes in between where you don't have those flares. There are some autoimmune disorder that can cause that. And usually that can be an autoinflammatory syndrome, such as Still's disease or juvenile arthritis. We have autoinflammatory syndrome such as familial fever, Mediterranean fever, TRAPS, things like that. That usually is associated with fevers. So you would have fevers. And you would have maybe abdominal pain, maybe you would have rashes, maybe you would have joint pain. But I would say that the most important key element for those are to have a fever, because that's, this inflammatory response that your body is doing. There's also, so that's like the first thing. Those don't have a positive ANA, yet they are indeed autoimmune. They are auto-inflammatory syndrome. In that same sort of like area, we also have gout and pseudo-gout. Gout and pseudo-gout, you do not have a positive ANA, yet they are super incredibly inflammatory. And you have this, super, a very inflammatory joint that you can see. They are swollen, they are painful, they are red, they are warm. You can even have fever with them. That is definitely inflammatory and definitely your immune system like causing all of this inflammation. Okay. That's gout and pseudo-gout. And in general, you can actually help with some NSAID that can actually both like the auto-inflammatory and this, they can be improved with NSAID. So ibuprofen, Aleve, Advil, meloxicam, things like that. Okay. So you can try that and see if you're doing better. But as you can hear, right, to make a diagnosis of those, blood work isn't really the first thing that I'm going into. The first thing is, how does it present? What are the symptoms that you're constantly having when you're having a flare? Is it just joint pain? Is it several joint pain? Is it joint pain and abdominal pain and fevers? Is it a rash? That is really what we're talking about, right? Are there symptoms that keep going and coming back? Okay. And then there is the autoimmune syndrome, such as rheumatoid arthritis, lupus, mixed connective tissue disorder, Sjogren, spondylarthropathy. So spondylarthropathy, that's just this own one group. We usually put ankylosing spondylitis, psoriatic arthritis, inflammatory bowel disease, uveitis, which is inflammation of the eyes, psoriasis. All of those, they are sort of in the same family. They're going to have inflammatory back pain. Low back pain is something that's usually very involved. You can have like blood in the stool. That would be another argument for this family. You can have inflammation of the eye, another argument for this family, ulcers in the mouth or in your GI tract. And then rashes, psoriasis, rashes. That is, again, that's not a diagnosis that needs an antibody. There's no antibodies in that family of very inflammatory conditions. And so again, how do we make that diagnosis? By asking our patients what our symptoms are, by looking at our patient, examining our patients, by doing x-rays and seeing if you have any inflammation and any evidence of erosion and type of erosion that can really help us. Looking at an MRI of the sacroiliac to see if you have inflammation of the sacroiliac. That is really how we make those diagnoses, right? And if you have any GI issues, having you get a scope to see if you have inflammation of the GI tract as well. That's important, right? Again, that whole family did not have antibodies, all right? And yet they are very inflammatory and our medications work really, really, really well for these patients, right? And then finally, we do have the lupus, mixed connective tissue disorder, Sjogren, all of those autoimmune that can have antibodies. And again, they can have antibodies. They often have antibodies, yet they don't always have antibodies. And here's the thing. The vast majority of time, we think that the antibodies come first and then the symptoms come. But we all in rheumatology have had patients where the symptoms came first and then the antibody came afterwards. And that's why we don't actually, there's a lot that we still have to learn about those antibodies. We do not know that they are necessarily causing the symptoms. We don't know that. We know that they are associated with the symptoms. And so again, for those conditions, we're going to ask you all of the same questions. Do you have joint pain? What type of joint pain it is? Do you have hair loss? Is it patchy? Do you have any rashes? Are you sensitive to the sun? Do you have any ulcers in your mouth or in your nose? Do you have a dry mouth, dry eyes? Do you have shortness of breath? Do you have dry cough? Do you have blood in the sputum? Do you have chest pain? Do you have any GI issues, and so on. And so we look at all of this, and then we look at your kidneys, we look at your blood counts, we look at your complement level, are they dropping? We look at rheumatoid factor, we look at cryo. And as you can see, right, like it's not just ANA. It's not just ANA. ANA is just very common because it's sort of like the first antibody that can get positive, and then you go into a little bit more details and look at other antibodies. But ANA can be positive for many reasons, and it can be also negative, yet you still have an autoinflammatory or an autoimmune or in general, a rheumatologic condition. So to complete this whole discussion, right? If you have symptoms of joint pain, or if you have symptoms of rashes that come and go, if you have symptoms of hair loss with patchy hair loss, if you have any inflammatory symptoms, anything like fever, anything like that, and your ANA is negative, don't stop there. Go and see a rheumatologist. If you are in the Denver or in the Colorado area, I still accept new patients and I would love to see you. You can jump on a call or go and shoot an email to my clinic manager, Amanda, at info@onabridgemd.com, and we would love to see you. And if you are any other places, you can come and check out Colorado, which is beautiful, and we can, I can evaluate you, or there are other rheumatologists, but do not stop at, I have a negative ANA, so I don't have anything. We know that even in lupus, you can have lupus, and it's rare. It's very rare, but you can have lupus nephritis, which is inflammation of the kidney, yet you have a negative ANA. We know that that exists, and that's why we do studies that are so long in rheumatology. So don't stop there. Make sure that you go and get evaluated, okay? And then I'm going to respond to some question. From Predator. Hi, Predator. Hello, can any buzz in the ears can be connected? Okay, so that's a very interesting question. Number one, anything rheumatologic. So anything can be sort of autoimmune / rheumatologic because it's a systemic, it's systemic, right? Like it's every system can be affected. We know that there are autoimmune disorders that can affect the hearing system. It's usually a conduction hearing loss. So you're having hearing loss. That's something that we can see. But in the ears, I would actually go and see an ENT and evaluate and make sure that it's not because of some the beginning of some hearing loss, because one, they can prevent it. Two, they can also see if it's anything else that's related, right? So you're going through that symptoms. You go to the ENT because it sounds like that's the only symptoms right now, right? And then we can go from there and see if you have any other symptom, if there's anything. But yeah, basically anything can be. And it's true, I forget to mention hearing because we know less about ear issues and autoimmune, but I can think about that, about multiple patients who had lupus and actually had hearing loss, and then their lupus got better and they didn't have the hearing loss, or they didn't have the tinnitus, so the buzzing. Yeah, you're welcome. You're welcome, Predator. And then, hi, Yasmin, Dr. Burr, Tiber, it's a pleasure to see you. Hi, Shana Vermeulen. And yeah, if you are looking at this letter as a replay, please make sure to write #replay. If you're listening all the way to now, and if you have enjoyed this video, please make sure to subscribe at my Rheumatology 101 on YouTube. It really helps us spread the word, and I think that that's important that rheumatologists are being heard. And then share this episode with someone that you think will find value into it. And with that said, I wish you a wonderful week, and I will see you next week. Take care, everyone. Bye-bye.